I'm Dr. Jignesh Dholaria, and I'm a family practice physician.
In regards to following the CDC recommendations, once again, we encourage everybody to cover their faces. Try not to touch your face as much as possible when you're out in public. And then the other thing too is always to wash your hands. Naturally, when you come back home, you always want to make sure that if you have bought some vegetables or fruits and those kind of things, if it's appropriate for you to appropriately wash them just with water. And when it comes to cans or any of those kind of perishable items, naturally you want to make sure that you've sanitized the surfaces before you stock them up. When it comes to your overall health and well-being, if you do have chronic medical conditions going on, then if you need to check your blood sugars, continue to do that as you're being requested to do so from your primary care doc or from your specialist. If you need to monitor blood pressures and make sure that you have a cuff, that you can do that. For some people, if they have chronic conditions such as congestive heart failure, then sometimes your doctors may be requiring you to check your weights on a daily basis or every couple of days. So if you have diabetes, then you want to make sure that you are watching your diet by limiting your starches, your fats, your sugars. If you have blood pressure issues, naturally we want to see how much you're doing in controlling your salt intake, but also eating healthier, where you're eating more green leafy vegetables and those kind of things. Now, naturally, in this situation that we're in with COVID-19, it's kind of hard to get the appropriate exercise. But once again, things that you would normally do, which is to do some cardiac exercises, whether that is walking or doing a light jog, is something that we certainly encourage you to do. But also then change it. And if you are doing cardio one day, the other thing that you want to do is to do some weightlifting. Once again, as you watch your diet, the other part of it is always going to be you've got to exercise.